Everyone, thank you for our patience as we got a little bit of business done up here. This is our 5th meeting of this study committee, and we will have 6 meetings because we are not going to actually approve any recommendations today. We felt a couple reasons. We felt we needed to hear a little bit more from the public, and there, has been a big election that has happened, that has and is continuing to happen, that has taken some of a little bit of our time. Would you say just a little bit? So we needed a little more time to go through everything we've heard, go through what's been submitted on the website, and just we'll be reading this. I'm personally going to be reading some of it over Thanksgiving break, so which I'm happy to do. This is a public hearing, and we have a sign-up sheet. I believe everyone has signed it, but if you haven't, then are there more names there?
There are more names.
Oh, there are more names. Okay. So if you have not signed up to speak and want to, the sign up is right here. Let us start this morning with a reflection. I'd like to just take a moment to invite the spirit or breath into our bodies in whatever form that might take, and share this reflection together. Holy Spirit, we know you by many names, but still we are part of one community. Open our hearts and minds so that we see love in the face of every person on this earth. Help us to form bonds of compassion, dignity, and respect. Guide us to fully grasp that differences within and among us never lessen the need for love, friendship, belonging, respect, and for the opportunity to work, contribute, and lead. Let prejudice, stigma, fear, and presumptions never interfere with our ceaseless efforts to assure that each and every person is able to feel and the embrace of family and the loving support of community. Amen. Okay, we have, before we start with our official agenda, we have a couple of reports from committee members. So Ashley, would you like to begin?
Thank you. On behalf of DBHDD, I would like to provide one brief update on behalf of the department. I've been providing ongoing updates regarding waiver admissions for the duration of this committee in response to the 513 new waivers that were awarded as part of the recent state budget. In addition to the 31 waivers that were awarded in July of this year, the 52 waivers that were awarded in August, and the 52 waivers that were awarded in September, I am pleased to announce that an additional 49 waivers were awarded in October of this year. And for those tracking, that totals 184 waivers thus far this fiscal year. Thank you so much.
Thank you. And Brian, your mic is number 8. Okay.
Thank you. I wanted to give a brief update on the 5% retroactive rate increase for the providers. I think I have some good news for you if you are a provider. The first set of retroactive rate adjustments for the 5% has gone through the quality assurance check and the approval process at the Department of Community Health. The first dates of services account for July 2021 through November 2021. Exactly 400,655 claims were adjusted. It means a total amount out to providers of $643,000. I can't do this. As you can clearly see, $12,751,643.82. I got there. But that I'm not used to saying big numbers like that, I guess. My checking account doesn't look like that. So that should show up on your EFTs. That's this week's weekly financial cycle, which means it should go, if you have electronic funds transfer, it should be in next week's electronic funds transfer. You need to be looking at your remittance advice for those claims that have been reprocessed. That's where you will see that reprocessing. We have another batch that is currently going through and when you deal with this much money, we do have a quality assurance process. Going through the quality assurance process and going through approvals right now. It's got the preliminary approvals, but it needs to go to our CFO and our Medicaid director, my boss, as well. It's another 390,156 claims, and it's for dates of service December 2021 through March 2022. So that'll get us close to current. It amounts to another $12,351,283.93. So another $12 million going out. We anticipate that will go out probably in the following week's cycle, which is around the 1st of December. And then we're working through the final set of reprocessing, which will be one more. So we're right on track to be completed with the process, as we told you, by mid-December, but you will actually start receiving the funds as of next week. One additional thing, I have gotten probably 20 to 30 calls across the waivers, ICWP, the Elderly and Disabled Waiver, GAP, which is the Georgia Pediatric Program, and the Now and Comp waivers from direct service professionals. And it's all basically the same call, which is, hey, Brian, we've heard you at association meetings or at the Senate meeting talking about rate increases, but our direct service staff are not seeing that rate increase. The department doesn't really manage that, right? We do claims. Businesses hire people for lots of reasons. They may hire somebody because they're rural, so they hire them at a little more. They may have a night shift. They may have more experience than someone else. So we don't mandate like where that actual rate increase goes. But if you're a provider, you may want to have that conversation with your staff. If you're a staff member or a family member that's concerned about the rate of your individual who's your direct service professional, you may want to have that conversation with your agency. Thank you.
Good news. Thank you. Do any committee members have questions for Ashley? Or okay, and your mic 6.
Thank you. First off, that is wonderful news. Glad to see such good progress. One of the things we've discussed at the last couple of meetings was the list, right? I'm going to oversimplify this again for a moment, but I think what we were determining that in the overall list that has, call it 7,000, whatever the number happens to be, that we divide that into 3 buckets. One is those in our special needs community today who are actually on the list, but aren't even eligible for the list yet. They wanted to get started early, right? So while that makes sense, we do need to separate who's actually eligible at this moment. And then in the list, we agree that there's some type of a percentage of folks that need more just traditional day services, et cetera, versus more extraordinary needs. When do we think we're going to have a true breakdown of what that list looks like?
We'll have to go back because we'll have to do that concurrently, I believe.
Yeah, so there are ways to prioritize the list based on need and various other components, right? So if we were able to have a sophisticated mechanism for prioritization, I think we would be able to bring that into various buckets. As you state, I would need a better sense of what specific characteristics of an individual that you would need in order to kind of look at that breakdown. And we do have a team of planning list administrators and a director who oversees the planning list who would be able to help navigate that. In order to do that, though, we would need some more points as far as what type of buckets that you're looking at, right? There's various ways to prioritize a list, right? And we look at need as the number one priority, right? So just having a sense of that, I think would help us navigate that. So perhaps we can talk more about that.
We certainly can, but just while we're all together here, again, I'm going to take the group of folks that are concerned that want to get on the list now that are not eligible. Just going to put them in a box for a moment. Nothing. Please don't take that the wrong way, but we need to focus on who's eligible today. We know that those in our special needs population need extraordinary care are of course going to be at the top of the list, as they should be.
Sure.
Right. But we've talked in the past that we believe that might be an 80-20 rule, that 80% on that list may need lesser services that are very critically important to that family, right? Such as day services, placement services, et cetera. We need to figure out the difference, because if we are looking at a budget number that says we can take 80% of the people and get them services very quickly for this much money.
Mhm.
And then for the other group, we can laser focus that on how we change things in a different bucket of money. We've got to get that down, right? Everybody in the one pile of soup is just obviously not worked very well. And we need to do a better job. So we can certainly talk offline, but I also will kind of turn it back to that group of, you probably know the logical cutoff better than I would, or Senator Harrell.
Sure.
All right, thank you.
Well, wasn't that kind of the purpose of having now and comp waivers, is that there's two levels of needed intervention, and that the now waiver is a lesser amount of service than the comp waiver?
Correct. The now waiver has a cost limit of $40,000 annually, right? So anyone who's receiving a now waiver has an annual max for all of their now services at $40,000 annually. The comp waivers for individuals who have more intense services, and there is not an annual cost limit on that, right? So yeah, that's safe to say that the now waivers for individuals who have less intensive needs with that annual cost
But
limit.
those are people that already have it, not those that are on the list. That's the challenge, is what's on the list today.
Correct. And we've talked about,
right.
so the real only difference between the now and comp besides the cost limit is there's not residential services, right? So the rest of the book of services are still available, right? But I think what we've discussed is narrowing that book of services even to a smaller book of services.
Right.
That might be community living supports for in-home services and adult day, which is, and you have to have case management. It's just required. So always be the policy person, but it's a federal requirement. So there would have to be case management there too. But you can limit it to that book and then look and see what portion of the planning list folks would, I think everybody would probably benefit from having those services on. It's a matter of how we triage the service and whether or not we wrote in the eligibility criteria certain acuity levels, which I believe we can do.
Absolutely. And we can move on to the folks that are here to speak today, because it's important we hear from what they have to say. But I'm a big believer that if 80% of that list needs a certain amount of services and we can give them something, it's 100% more than nothing. Even if it's not a full $40,000, let's say it's $8,000 or $10,000
Sure.
for the services, we just impacted a lot of people's lives.
Sure. Absolutely.
Can I ask one more question before we move on?
What's your mic number?
My mic is 4.
Thanks. So I really appreciate these updates. Ashley, I wanted to check on the folks getting onto the waivers. What is the target date to have all 513 awarded?
So that was the appropriation was from July to July, right? So the goal would be for all 513 slots from the 23 budget to be fulfilled before the end of the fiscal calendar.
Okay, so before the end of June next year.
Correct.
Okay, thanks.
Okay, if there are no other questions from committee members, we will move on to our agenda of speakers. And our first speaker is Heidi Moore. We're pleased to have you join us. I know you've tried to join us several times before, so we're glad you made it. Yeah.
It's gonna help me today.
All right.
Okay.
Yeah, come on, Jacob. Come on. Yeah, you could leave your books there.
Okay.
Okay. Can you tell everybody your name? What is your name?
Thank you.
My name, Jacob Moore. Moore. Yeah. Okay. Well, anyway, for those that don't know me, I'm Heidi Moore. I'm the ghost. A lot of people know me. A few people were like, I've heard your name, but I don't know. I've never met you. I have been involved with advocacy for over 20 years here in the state of Georgia. The biggest claim to fame I had was for the Katie Beckett waiver, and advocating 3 years in a row to not have a sliding scale for our families. We defeated that 3 years in a row in the legislature, and today the reason why you don't have a fee for service or a fee for your Katie Beckett is because of the grassroots advocacy work that I was involved with back starting in 2003. So, and then all the way up to the COVID and prioritizing the disability community and working with Governor Kemp's office for that as well. So I've been involved in a lot over the years, and today we want to talk about just some of the concerns that I have with expressing the concerns and what some of the solutions may be. So you guys all have a copy of my agenda. I'll go through it very quickly. Do I have 5 minutes? How long do I have, John?
Oh, yeah, give it to 5 minutes.
5 minutes. Okay. Okay. Well, first of all, I want to say thank you to John. For those that don't know, John and I go back to 2009, that far back. Senator Moody was my state senator at that time. Love that man. Wish he would have won it at the U.S. representative, when he went for election for that. But anyway, John went to Dan and said, I want to learn about different populations that I'll represent if I run for senator. And one of those populations that Dan Moody talked to you about was the disability population. And from that, John contacted me, and we said we were going to have 20 minutes. We were going to meet at Starbucks for 20 minutes. I think that meeting lasted 2 hours. And ever since then, John has been an advocate for the disability world. He's become a staple in our family. And him and his wife, Carrie, have been to the hospital many a times for us when Jacob was going through cancer treatment. And I know John has the heart of our children. And I just want to say publicly, thank you, John, for representing our population when no one else would. I'll be honest with you. When Dan Moody left, it was tough. There was a hole. So thank you. So anyway, I'm going to get through the concerns first. Difficulty in navigating the disability services throughout the system. It is very hard. I was just trying to find yesterday how to sign up for the DBHDD newsletter because somehow I've gotten taken off and I couldn't find it on the website. Simple things like that. It just makes it very hard for families to navigate the system. Yeah, you can make a note of that, Ashley, that it's an issue. The long waiting list, that's a huge one. I mean, we've got over 7,000 families, and I'll be honest with you, that list is probably a lot larger than that. Those are the people that have applied and gotten approved. So there's a lot more families out there. Switching, one of my concerns is switching to a managed care system if that's a route we want to go. I'm adamantly against that just based on the research I've done in other states. I have not been able to find one state that has successfully implemented a managed care system in the Medicaid system. And I'll get into that in a little bit. The low funding rates. That is a huge one. We're not competitive, guys. When the rate for a direct support service or a caregiver is only $12 an hour with the Medicaid vendor, $12, you can't even hire anybody at McDonald's. So we really need to look at making ourselves competitive so our individuals get the services that they need. Other issues is lack of flexibility of transferring funds within the waiver system, computer technology. This is one of my hot buttons, and John and I were actually talking about this the other day. We've spent a lot of money on technology in this state, and the systems are not adequate. Jacob, come on, buddy. You got a few more minutes, okay? The system is just not adequate. Example, for those that have the waiver, we were told that we would have access to seeing our services and being able to be a part of the portal. That has not happened. And we have a new millions and millions of dollars technology system that was implemented in August of 2019. Things like that. It's just very upsetting that we were sold something that has never transpired. Aging out. This is one big issue. And this is where managed care becomes an issue, is that we recently went through that. Jacob is 22 years old. So he has 13, and I'm jumping around here, has 13 specialty doctors. I started working on transitioning out of pediatric services at the age of 18 because I knew it was going to be that big of an issue. I'm telling you right now, the Medicaid providers are not out there. It was hard. And I know a lot of people. Do you know who people come to asking, where am I going? Me. Because I went through the process. But what concerns me is if we do go to some type of managed care system, it will significantly reduce the number of providers within our system. We saw that when they implemented managed care in the low income population. And I can't remember what year that was, but I do remember hearing a lot about that with the Mirror Group and some of those other groups. But Jacob's here today because I wanted to put a face to what this is all about. Jacob is 22 years old. He has Down syndrome, he has autism, and he's a cancer survivor. He's had over 200 surgeries. We were very blessed in 2006 with having to be awarded back then it was called the MRWP. Brian knows what that was. I mean, thank goodness we got rid of that word and that terminology. You know, I didn't know at the age of 6 that 4 years later, he was going to have cancer and almost die multiple times in the hospital. You just don't know what you don't know. And the waiver has been, and this is where I'm going to get emotional, guys. The comp waiver has been our family's saving grace of staying together, not having to file bankruptcy for the things we need, as well as with Medicaid and all the specialty doctors, the therapists. The reason why I'm able to be here today is because of Ruben, the RBT that's working with Jacob right now, and Hamali, who's a BCBA. I couldn't have come today because we are having some severe behaviors. You're not seeing them right now, thank goodness. But you know what? These are the kind of services families need in order to be successful. Having good doctors is why we're so successful. I wanted to say also that, you know, Jacob has another side. It's not just about doctors and therapists and all these things. I wrote on my thing, what does he like to do? He likes to read. We have books everywhere we go. He loves music. He was in a concert of Songs for Kids this weekend, got up on stage in front of a couple hundred people and sang Shake It Off. Didn't you? Yeah. Did you? You did. He loves baseball. He plays baseball on an adaptive team. And you've been to a lot of Braves games, right? Field trip. Yeah. You like going field trip. He loves to go to theme parks. He loves to see Mickey rides. He likes to go on the rides. Okay. He loves the roller coasters. He loves the thrill. He loves Tower Terror. Tower Terror is one he likes the drop. And he loves Christmas, but he loves all the holidays. He has a bow tie that has Santa on him, but he has socks. If you look at his socks, he has Halloween socks on, guys. Go figure. But you know what? I embrace the difference. So I guess why I wanted to bring this up was it's the success of all those things that have made him into what he is today. I have no doubt if we wouldn't have had Medicaid, we have primary healthcare insurance and it's good insurance, but we have Medicaid as secondary. We have the waiver. We don't have family down here, guys. Everything that we do, we either have to do it ourselves or we have to get family and friends in, or the waiver has to pay for it. And I am so grateful for the waiver because I have seen firsthand the importance of it. And it kills me as an advocate, as a mom, as anyone, that 7,000 families are waiting for what we have. So I didn't have to be here today because I have what I need. I'm advocating for all you all. And I see people here in the audience that's shaking their heads because I know they need it. They need it just as much as we do. So we need to do something different about this. So what can we do? Oh, so no, one more thing. So another reason why, and this is something I came up with last night and I had to change my paper. Is that I got one more minute.
You're about 4 over, but
geez, I'm sorry. I get passionate. Anyway, in the current waiver system, we have support coordination. We have nurses reviewing our cases. We have that type of infrastructure to support making sure that individual gets the needs that they have already. We don't need another layer such as a managed care. It would be a duplication of effort. And so anyway, so in closing, individuals continue to need to have access to healthcare. It's so important with less paperwork. Disability services is a bipartisan issue. I love that we have this committee. This is the first time I have seen this in 20 years that Democrats and Republicans are getting together to talk about these issues. We need to continue this. This is something we need to keep doing. Better utilization of data to prioritize the waiting list, like what John was talking about. Flexibility of hiring family members. I think that is an untapped market of things that we could do in order to get quality healthcare professionals. And then overall, better transparency and communication to the families. It is very hard. Ashley and I, we work, and Brian, I've worked with them many years on different councils, different things, represent the families. And sometimes I feel like I'm the only one communicating back to the families. And Ron Wakefield is very aware of my passion with that. I truly believe we need to do a better job of communicating directly back to the family. So I'm done. Thank you.
Thank you, Heidi.
Jacob, you want to say thank you? Oh, you want to say one thing? Okay, say one thing real quick.
Okay.
Say thank you. Okay.
Hey.
Thank you, Ms. Moore. So my co-chair, Senator Albers, and I have both talked about how the work of this committee does need to keep going, that we have merely scratched the surface. And I'm sitting here thinking that if we don't already know the number of people on the waiting list who are there early, because they know their child is going to reach the age 22. We should be looking at that data, and we should know exactly how many people are going to reach that age and when, so that we can budget appropriations for that in a forward-thinking way in order to make sure there's a smooth transition from K-12 education to aging out of K-12 education.
And it is one of the most difficult things families run into. And we did it during COVID too, which added a whole nother complexity, but it really is. And my concern is limiting the access of providers when there's already a limited number of providers to begin with.
Right. Thank you so much. Our next speaker is Dr. Jose Delgado in community on behalf of Unlock the Waiting List 2.0.
Yep. Thank you so much. Well, hello, everyone. My name is Jose Delgado. I'm a California native, turned Georgia Peach about 7 years ago or so. In addition, for the last 3 years, I've served as Chief Operating Officer of Georgia's largest IDD provider in community, serving over 1,800 individuals each year. And I believe I bring a unique perspective to this conversation, not only for my IDD healthcare executive work, but also for my background as an emergency medicine physician who has worked in California, Ohio, Alabama, Mississippi, and Georgia, and allows me to see issues from both an administrative and clinical lens. I've also asked colleagues of mine in several states to share their experiences with me in preparation for this session. And today I would like to focus my testimony on a topic that I've repeatedly heard come up, and that is managed care as a service delivery model. For those of you who do not know, the aim or idea of managed care is to reduce program costs and provide better utilization of health services through the contracting of managed care organizations, otherwise known as MCOs. That might look something like United Healthcare or Amerigroup, who would in turn coordinate and manage providers. Now, to be fair, nearly 20 states have planned or implemented some version of managed care for the IDD population. Models range from multi-state commercial health plan contracts to local provider-led initiatives and have varying benefits, requirements, and payment methodologies. What is evident, considering the challenge presented to each state, is the fact that managed care looks different everywhere, with often mixed financial and healthcare outcomes resulting, which should be our first red flag to outright adoption, as there is not a standard of measure that has created consistent results for providers or IDD persons. In other words, there's a good chance we may end up with another fractured system and limited healthcare access that feels like a waiting list of over 7,000 persons strong, or should I say in despair. Despite adults with IDD being more likely to incur higher annual healthcare costs that people without IDD have, and the fact that Medicaid managed care has existed for decades, it has not commonly been utilized for the long-term services and supports of people with IDD. One of the reasons for this is because people with IDD are a unique population that you all already know. In many instances, they require a different set of services and supports than non-disabled people or even people with other types of disabilities. And managed care would impress upon this population to afford for these extra costs. That could leave families paying high out-of-pocket fees or seeing someone like me in the emergency room for care when they can't afford it. While some believe managed care represents an opportunity to reduce costs, in reality, utilization of managed care for people with IDD is actually low. And there's little research about quality standards for the managed care of people with IDD. Moreover, the majority of existing research about managed care for people with disabilities is about healthcare services and controlling costs, but not about quality. Not only is quality managed care provisions for people with IDD understudied, I fear it may also be implemented without an appropriate evidence base as a result. Again, the stated rationale most have heard moving away from a state-managed Medicaid and into a system administered by private for-profit making companies is cost savings. The change is supposed to save taxpayers a fortune while also resulting in healthier IDD individuals, as was the case in Iowa when they implemented managed care a few years ago. But they experienced a rude awakening. Privatizing this care was costing more and at the same time resulting in complaints from families and providers. Reasons for this included checks via managed care being slow to arrive, each managed care system having its own billing systems and processes, IT systems not congruent with MCOs in the state, IDD services being paid at a lower rate, and private sector administrators and executives being paid more than 3 times what a non-privatized state director or nonprofit leader would make. After the first year, Iowa's 3 MCOs ended up renegotiating their capitation rates, which are monthly per member fees the state pays the insurers to manage Medicaid, and then informed providers of home and community-based services it would no longer pay them the agreed upon rates, but instead would pay the absolute minimum Medicaid rate regardless of the individual's needs, holding individuals and providers hostage without room for debate. In Texas, privatization led to the higher spending on prescription drugs. 4 years after the transition to managed care, spending was 30% higher in affected counties. This included life-saving and vital drugs like insulin, antipsychotics, statins, asthma inhalers, pain and seizure medications, all because managed care capped spending to boost revenue and support their large overhead. Amongst 111 care systems surveyed overall, privatization was associated with the 12% increase in total spending, and capitation payments to private insurers were set higher than the actual fee-for-service costs of the original state plan. In other words, findings run counter to the consensus in the policy community that private plans save money, and more towards the conventional wisdom among economists that privatization in Medicaid leads to worse outcomes. I would like to challenge you all by focusing on several areas that I and my colleagues of Unlock 2.0 believe warrant further attention going forward when it comes to managed care, including the following. 1, gathering additional health research and data that would help you as policymakers to better understand and support effective programs for the population. 2, consideration of support needs in the context of families, including addressing multi-generational caregiver issues and other models of care outside of managed care. 3, encouraging adults with IDD to exercise informed decision-making and have their preferences honored at the managed care table. 4, research and evaluation on the effectiveness of other state initiatives designed to address workforce issues to help inform policies that support the stability of quality of our workforce going forward under a managed care setting. And lastly, in these recent years of the pandemic and broad social change movement, the need to address equity issues and health disparities for people with IDD, and particularly people of color. Issues that historically have become worse when privatization enters the healthcare arena. Let me be clear. This is not to say the IDD system as it is has not been plagued with unsustainable costs, inefficiencies, and inconsistencies. Current fee-for-service models do not encourage nor promote efficiencies and thus have led to high utilization. And the shift from institutionalization to home and community-based services has presented additional problems with community, employment, and financing integration for this population. But jumping into a new system without the proper research, evaluation, and funding will almost certainly make these problems worse. Thank you for your time and consideration.
Thank you.
Thank you, Dr. Delgado. Always wise to look at the experience of others instead of starting from scratch. Our next presenter is Darcy Robb. You can speak from wherever you're comfortable. Here, there.
I will stand.
Okay.
You know, thank you. I
Yes.
appreciate that. Okay, thank you all. I want to own up that when I rehearsed this presentation, it was definitely longer than 5 minutes. I'm going to try to make some thoughtful edits as we go through to move us along here. Before I get started, though,
We'll give you 10 minutes.
I get 10. Okay, great. I think I can
You're
do
a
that.
committee member.
Thank you. Well, I want to start my 10 minutes by just saying good morning, my fellow members of the study committee, everyone watching, and just saying to everyone on this committee, thank you. I want to really very sincerely express gratitude. I echo what Heidi says. This is not something that I've seen before. And in this committee, we have heard some really hard testimony. And I want to honor that, but I actually find hope in that because unless we hear the hard testimony and the hard stories, we don't really know what's going on out there. So I really appreciate everyone on the committee, the organizations, especially our bipartisan leadership. You know, it's only if we look at what's really going on that we're going to get to the root of these problems and build solutions together. So thank you all for that. All right, so you all know me. I'm Darcy Robb, the Executive Director of the Georgia Council on Developmental Disabilities. And you can see that in my presentation, I'm going to focus on some statistics, some services, and share some thoughts on recommendations for improvement. And, oh dear, Rachel, my clicker's not working. Thank you. Okay, so we're going to start off very quickly looking at GCDD and how we define developmental disability. Next slide. Next slide, please. Thank you. So at GCDD, our mission is to bring about social and policy changes that promote opportunities for the wide spectrum of folks with developmental disabilities and their families to live, learn, work, play, and worship in their Georgia communities. Next slide, please. So when we talk about a developmental disability, we sometimes talk about it as being an umbrella term. Oh, I'm sorry, I'm getting ahead of myself. At GCDD, I think it's important for you to know we are federally funded and we are self-governing. And as per the legislation that created us, over 60% of our members must be folks with developmental disabilities or their family members. So I think that's really critical for y'all to know about us and where we come from is we are governed by people who are experts in developmental disabilities, thanks to their lived experience, either having a disability or loving someone who does. Now, next slide, please. This shows how we look at a developmental disability. I'm not going to go through every bullet point with you all, but as you can see, it could be due to a physical or mental cause or combination of both, starts before age 22, likely to continue indefinitely, and it results in substantial functional limitations in 3 or more, and you can see these areas of major life activity. The biggest thing I want to point out here is developmental disability is an umbrella term. Somebody whose challenges are in language and in learning, their experience of disability is going to look really different from someone whose functional limitations are mobility, self-care, and capacity for independent living. But nonetheless, a developmental disability, that bottom bullet point essentially says that all folks are going to need support, either extended or lifelong. I want to take just a moment and contrast that with our eligibility for waiver criteria. Next slide, please. So I'm not going to go into these slides in depth, but essentially when we look at who's eligible for now and comp waivers, there are 2 paths in, and one is to have an intellectual disability. And that, of course, means that onset prior to 18, limitations in adaptive functioning. Next slide, please. And the next slide talks about that IQ piece. Traditionally, that's been set at 70. I like that there is some flex here for up to 75. The other path to receiving eligibility for now comp is through a related condition. And essentially what that means is something that is closely related to, looks like, and functions a lot like intellectual disability. Next slide, please. I'm not going to go through these given time limitations, but I thought that it was worthy to look at this, trying to make the point that when we say developmental disability, at least those of us who are governed by the DD Act, we are looking at a broader population of folks than qualify for the now comp waiver. And so for purposes of this committee, part of our longer term conversation, I think will need to be, how are we supporting the folks who wouldn't qualify for this type of support? Now, the flip side of that is we are setting a fairly high bar for getting now or comp. And so the folks on the waiting list who are eligible for these waivers, they need these services. You know, I can honestly tell you, I can't think of an instance in which I've known someone to be approved for the waiver and there's a question of whether they need the services. So I think we can all rest assured that there is a verified need there. Next slide, please. I wanted to spend more time on some intellectual disability and developmental disability statistics and services. Next slide. So the first most logical question is, when we say Georgians with IDDD, how many people are we talking about anyway? Well, that top number is what those of us on the DD Council have to cite in our federal reports. Long story behind that I won't go into, but that 170,000 number is actually from the mid-90s. So this is an old number, okay? We think it's more accurate to look at that second bullet point. State of the states in intellectual and developmental disabilities is a longstanding reputable source of data from all 50 states. And as of 2022, they found that there are approximately 226,000 families providing care for someone with intellectual developmental disabilities in Georgia. Still in that ballpark of 170,000, but we think that figure is more accurate. Now, this slide is one that I created. So, okay, if we've got about 226,000 folks providing care, the most recent census in 2020 showed we've got about 3.8 million total households in Georgia. You put those numbers together, again, this is an approximation, but you get that approximately 6% of families are providing care for someone with intellectual or developmental disabilities. So somewhere in the 200,000s. Now, when you look at our now and comp numbers, the first thing that I find striking here is this is a lot lower than the 220-some thousand. And I think, quite honestly, it would take some time and some really careful analysis to tease out exactly why that is. Now, one reason we have to remember is that everybody we would consider having a developmental disability will not qualify for now comp. But you can see these were, I believe, Ashley's numbers as of August. We had just over 13,000 receiving now in comp and a little over 7,100 on the waiting list. So the other question I think this slide begs, in addition to why are these numbers so much lower than the population at large, is, well, if we consider that I think everyone in this room knows how necessary these services are, and that we are looking at a relatively small segment of this population, you know, why do we even have a waiting list at all? The short answer is funding, but we wanted to take a deeper look at that, and that's what this next slide is hopefully going to help us do. So this is a slide that shows fiscal effort. This is a measure that State of the States likes to use to compare state efforts. So the capacity measure, we're looking at fiscal effort defined as the spending on IDDD services per $1,000 of personal income. And you can see the US average there is $4.60 per thousand. We in Georgia are significantly lower than that at $2, and I believe that's 82 cents up there. And I wanted to put our peer states here, you know, to show our regional states, and you can see that we are low even for the region in our investment. I bring this up because I think it's an important point of data clarity in terms of why do we struggle to fund this wait list? You know, we are devoting a relatively small slice of the pie when we look nationally and when we look at peer states. And I think that is helpful to know. Next slide, please. So here's some more perspective. And again, if you go back to those 226,000 families that are estimated to be providing care for someone, only 4% of them are receiving state support. Now, as you can see, you know, in all states in our region, it's well under half of families. But I think this is just another important point that raises the question of, okay, we know we have folks with intellectual and developmental disabilities throughout our states, throughout our communities. We know that our state investments are low relative to the rest of the country on average and our regional states, but it's not as if people aren't there. So, you know, who is providing this care? Who is paying for it? Next slide, please. The answer to who's paying, I think we've heard in this committee all along, it's Georgia families, it's Georgia businesses. Our providers are under terrible strain, but most of all, it's Georgians with intellectual and developmental disabilities. Because if you need support to access your community and share your gifts with the community, honestly, I think that is a tragedy if you can't get that support for you, but also for the rest of us, because the community is not benefiting from that person's contribution. The next slide has a quote that I wanted to share that I thought summed up the situation. And this is from a provider, which GCDD does not always quote providers. So this is a special moment. You know, we love you, providers. But one of the providers that I've been, working with several times in these past few months has talked a lot about families breaking. And he said something to me a few months ago that really rang, which was families have to break before they can get support, and usually in a way that hurts the person with disabilities. I realize that this is a low emotional note, but that struck me. Now, we're not ending there. How are we going to make it better? Next slide, please. I think that what we have not done is shifted our mindset, because waivers and services are critical human services. That's absolutely true, but they are also economic development tools. When you have folks with disabilities getting proper support, their family members can keep their jobs. They can get promotions. They can keep giving to the economy. Our businesses, our providers, they can pay folks. They can pay folks a livable wage, even a middle-class wage, if we get the formula right. And then those folks are pumping back into the Georgia economy. And finally, you have folks with developmental disabilities who can contribute to their communities. This is especially salient if we arrange our system to prioritize employment first. Now, employment first is something I am passionate about. I have seen that it changes lives and communities. And employment first is really the concept that when we're looking at what someone with disabilities does during their day, if they are in the publicly funded service system, we must look at competitively paid employment as the first option. Next slide, please.
DRC, just a quick timer. We're at 15 minutes already.
15. Okay. So I won't go through all this. The next slides just show that there are studies to back up these numbers about waivers being economic development tools. Next slide. We will skip that. These are just the studies back. Oh, I'm sorry. Can you go back a few? That's okay. Back one more. Back one more. Back two more. Okay, one more and then I'm done. All right, so wrapping up, I think other states are catching on to this reality of waivers being an economic development tool. And I say that because states, not California, not New York, Arkansas and Oklahoma over the past year have ended their waiting list. Arkansas and Oklahoma. Yeah. Right, applause for them. I want applause for us. 37 million, 32 million. Next slide, please. Now, Florida has not ended their waiting list. However, they have put major investments into it, 95 million and then almost 60 million, moving thousands of people off the list. The next slide is a list of states here in the Southeast that have used ARPA funds to reduce their waiver waiting lists. So this is very much a trend in our region. Now, bringing it back home to us in Georgia. This next slide is a chart. This shows how much adult DD services take up in our fiscal 23 budget. $405 million, that is a big number. Nobody's going to deny that. But I think it's critical we look at that. It is in the scope of our $30 billion state budget. And the amount we spend on adult DD services is just over 1%. Now, when you think about how critical these services are, when you think about the economic arguments for providing waivers and actually reinvesting in our economy, and when you think 6% of families are caregiving, I think that makes a strong argument that we need to look at investing more. A few ideas for where we could get this investment. Next slide. Thinking about the 2023 refunds. Now in 2022, Georgia gave 1.1 billion in tax refunds and $250 per person. Something to think about. A $25 reduction in that would have almost wiped out our waiting list. Now what's done is done. What's done is done. But we need to think about what does that mean for us in 2023. We have a $6.6 billion surplus, 0.3%, not 3, 0.3 could fund 1,000 new waivers.
I'm going to ask you to focus on the issue at hand, not where we get funding sources from, if you would.
Okay.
Please. Thank you.
We will skip these funding ideas. Moving on. So short-term advocacy and strategies. Here at GCDD, we are going to be advocating for more waivers. We have heard consistently the need. We are recommending 1,000 new slots. That would be just under 20 million. approximately, as well as funding to increase the DSP wages to a minimum of 15 an hour. We also think it would behoove us to update a long-term DD services plan. Now, going forth long-term, Senators Harrell, Albert, I really appreciate you all having committed to this work being long-term, because it is. Next slide. These are our long-term recommendations. We need to end the wait list. This is going to take a period of some years, but we need to fully fund, and as y'all were saying with the data, keep our eye on the service needs, keep DSPs at a livable wage, centralize employment first. We need to maximize our resources. Medicaid care model changes, our recommendation is to consider those with great diligence. And finally, we need to develop long-term person-centric service evaluations to make sure these services are meaningful. I apologize that I've gone way over time. I hope the information was useful. And again, I thank you all.
Thank you.
Thank you.
And our final speaker before we move on to the public testimony part of the meeting is Doug Crandall with Advancing Employment.
Thank you. Thank you. Good morning, everyone. I am Doug. I work at the University of Georgia, where I direct a GCDD funded project known as Advancing Employment. I would be remiss this morning if we didn't take some time to honor Lois Curtis, who we lost in these last 2 weeks. Those of you who don't know, it's not too late to Google and be inspired. Lois, along with 2 other women, took their case here in Georgia, named after Tommy Olmsted, all the way to the Supreme Court. And I sure hope that the future holds that we start to amend the Olmsted Supreme Court decision title and call it the Lois Curtis Supreme Court decision. She was a wonderful human being, folk artist, writer. We should be proud. We have some great things we do in Georgia, and I'm going to talk a little bit about that. I've worked in the field of employment and disability supports for over 30 years. I am the formal advocate for my sister with disabilities who lives in Indiana. We were always, because we grew up on a pig farm, expected to work. There wasn't a choice. The doctor said to my folks, "You've got a lot of kids." By the way, they're all named D's: Dan, Doris, Derek, Pierre, and Dina, Dana, and Doug.
It's funny.
So put her in the institution in Kokomo and move on. And my father said, "No, we need people on the farm to work." I'm reminded of him this morning. He's passed. These are called, look up if you don't mind, look up at the ceiling. These are called MT454 foil backs. That ceiling tile is made only in one place and no longer, LaGros, Indiana. I worked with my dad there to get through college. My point being that work is instrumental to who we are. And thank you, Darcy, for pointing out all of the economic reasons. I'm going to add to that and keep my comments brief, mostly related to what are known as the National Core Indicators. And if you want to look that up on your device, it's the nationalcoreindicators.org for IDDD services. But households in the United States represent $68 billion worth of purchasing power if they have a member with an intellectual and developmental disability, $68 billion. When we put people to work in the IDDD system in Georgia, every person that goes to work through supported employment returns to taxpayers over $3,000 every year, each year. Sometimes it's a combination of needing additional funding and doing things differently. Let me point to some of these national core indicators that we do need to work on. In Georgia, 70% of the folks in IDDD service systems attend a day program or a sheltered workshop. I should also say I am the author of a book published this year by Cornell University Press called 22 Cents an Hour, Disability Rights and the Fight to End Subminimum Wages. It is still legal to pay workers with disabilities subminimum wages in Georgia. 70%. The national average in a day program or sheltered workshop is 42%. Way too high for us. Second point. This indicator gets at, I would like a job in the community, but I haven't got one. 54% of folks in Georgia indicated, I want a job in the community. We're not delivering on that. Third data point, the reasons why families and folks with disabilities say that they do not have a job. 50% say they don't want to leave their current situation. That national average is 36%. We can all understand that all that takes is some education, some counseling about the benefits of working in the community. Fourth data point. In Georgia, for the folks who do not have a job, 6% say it's because there are no jobs. Have you gone on Indeed.com or looked any place in Georgia? Tens of thousands of positions open, also education. Our folks and their families with IDDD in Georgia have been convinced 6 times more than anyone else in the United States that there aren't jobs. The fifth one, and this one should really raise some alarms, has a goal in their ISP, their service plan, that they will go to work. In Georgia, that's only 13%. Nationally, that's 27%. Why is that? We need better support coordination in terms of understanding employment supports, accommodations, customizations, supported self-employment. Those are the 5 data points I wanted you to benefit from. I want to also point you to our advancingemployment.com website. We have established for the last 4 years within the DD network 8 policy imperatives, and there are 2 low-hanging fruit that we can benefit from. One is something called state is model employer. Anyone? State is model employer. Tennessee is beating us. They've got state as model employer, which means state agencies say, come on in. We need you too. We'll accommodate, we'll customize. Then state agencies can say to public, private businesses, we're doing it too. We don't have state as model employer here. At the end of October, we had an event at the Carter Center where we created a blueprint for state as model employer in Georgia, and we're calling it GAME. Georgia's got GAME. Georgia as model employer, the final one on these policy imperatives. We can use a state-specific tax incentive that goes directly to employers, state-specific, not the federal one, for those employers hiring folks with intellectual and developmental disabilities who had been forced to work on sub-minimum wages in the past as their only choice. I appreciate the time. Thank you very much.
Thank you. I'll be the bad guy now. Okay, before we get into everyone who signed up to speak today, this is where I have to be the bad guy again, and I'm sorry. We've got a lot of folks signed up to talk. And if you use more than 2.5 minutes, you will have taken
3.
time away.
3.
Hang on a second.
It's only 10 people.
I understand. I'm gonna set 2.5 minutes. My alarm's gonna go off, and you'll have 30 seconds to wrap up.
And that's 3 minutes, yes.
But to do that, we're going to need you to follow that, because if not, you will literally take away somebody else's opportunity to speak. And we want to be kind and compassionate and give everybody that opportunity. Okay, so what we're going to do is Senator Harrell is going to list off the person talking and the 2 people on deck. So if you're kind of in the back there, you get yourself ready to come up to the podium. We appreciate it. Thank you.
I must say, I've had to rewrite quite a number of speeches to get it down to 3 minutes. And when I actually deliver a speech that's 3 minutes, I feel like I'm saying it better than I would have if I had taken longer. So you can get a pretty good message, passionate message delivered in 3 minutes from my experience. We have first speaker is Rita Young, followed on deck by Kim, is it Weiner?
Good morning, everyone. Good morning. I have copies of my presentation and I will stick to the time frame. Good morning, Senators, study committee members, and attendees. My name is Rita Young, and I'm the Grassroots Engagement Director for a newly formed disability coalition called Unlock 2.0. Our mission is to advocate for greater investment in home and community-based services at the state and federal level, and to ensure the quality and accessibility of those vital services. Promoting greater access to employment, housing, and healthcare will also be key in our efforts. The Unlock the Waiting List campaign was a successful advocacy coalition in the early 2000s. Under the administration of Governor Sonny Perdue, Unlock advocated for over 3,000 new Medicaid waivers for people with developmental disabilities, and Georgia invested approximately $100 million in both state and federal dollars into services over a multi-year period. Without the support of Governor Perdue and the Georgia General Assembly, this could not have been achieved. And there are countless families that benefited from that investment. We support the critical work of this committee and offer the following 6 recommendations to strengthen home and community-based services in Georgia. Number 1, fund 1,000 new Now Comp waivers in the FY24 budget. We're basing this number on the approximate number of students graduating from high school annually, along with the approximate number of caregivers over the age of 65. Number 2, increase starting wages for IDD direct support professionals to $15 an hour. Number 3, give a cost of living adjustment to IDD service providers. A COLA would serve as a basic assurance for service providers to help keep up with the cost of inflation and the rising costs of doing business. Number 4, develop a new multi-year plan to address the Now Comp waiting list that includes a timeline and measurable outcomes. We suggest the plan include outcomes to reduce the waiting list by a specific number or percentage annually. Number 5, Senator Alpers, you may like this one. Request pertinent data points such as age, county, race, ethnicity, and application date from DBHDD on the 7,000 individuals on the IDD waiting list for the purposes of planning and analysis, and thoroughly considered the impact of managed care to our folks with IDD. We look so forward to working with you on viable solutions that benefit Georgians with IDD during the 2024 legislative session and beyond. Thank you so much for the opportunity.
Thank you. Now, Holland Post, you're on deck.
Good morning. Thanks for all your work. My name is Kim Weinreb, and I'm a resident of Peachtree City. I have a 23-year-old son who had a stroke prior to birth that left him with hydrocephalus, seizures, global developmental delay, cerebral palsy, vision issues, autism, anxiety, and oppositional defiance disorder, depending on the day. Sam has been on the wait list for a waiver since he was 14. Upon graduation in 2020, I made a phone call to let them know that he would be needing services. And of course, mid-pandemic, they were operating on an emergency basis only. I was asked if I worked outside the home. I was asked if we lived in a home, and I was asked if anyone in my family was in jail. No. He, along with other, 7 other plus, we are in the bucket list, one of the buckets, whichever one you want to put us in. Along with other individuals that will continue to decline without services they will most likely never get. While the squeaky wheel does get the grease, I don't see Sam ever getting the services he needs to help him become an independent as he could possibly be. As a college student, I worked for United Cerebral Palsy and took care of individuals with CP who lived in their own apartments. I made $6 an hour. And it seems that that amount over the last almost 30 years has not increased very much. You cannot expect a person to help dress, toilet, feed, drive, monitor meds, manage behaviors, and essentially keep someone alive for $12 an hour when they can work at a variety of other jobs for significantly more. Parents like me are stuck. We have little to no support once our children age out of school. We are on one waitlist after another with no hope of getting that support. While I recognize that it's not the government's responsibility to fully care for my son, I do wish more resources were allocated to help our families. Our children are the most vulnerable community in our country and in our world. Where are the parades for them? Where are the hashtags for them? Where is the support for families like mine? Families have the daunting task of not only taking care of our children for the rest of our lives, but must plan care well beyond our death. We can never die. Housing is almost non-existent unless a brave group of parents step up and create a change. Many of these housing options are $4,000 a month, which is $50,000 a year, which is almost $2.5 million over the course of 50 years. We are allowing these individuals to suffer, to be isolated, to be left in unsafe environments as we are allowing these families to suffer. We've got to do better. I invite you to spend time in your home. I invite you to spend time in our homes and see what our days, our weeks, our months and years look like. We would do anything for our children, and we would hope that you will see our struggles, see the lack of support, see the lack of resources, see the exhaustion, but also to see the joy. Thank you.
Thank you. Nancy Knight, you're on deck.
Hi, good morning. My name is Holland Post. I'm a parent. My wife and I are parents of Charles Post, severe autism, nonverbal. He's got a lot of behavioral issues. He's not with us here today because he is an out-of-state residential treatment facility due to lack of resources in our community. Just to keep this quick, I didn't intend to speak today. I just trying to be seen and heard to advocate for him. But we kind of boiled over at the house in the springtime. We ended up at Laurel Heights, which was our nightmare scenario. That was our last stop for help in the state of Georgia. And then we were told that he was going to get discharged, that they would not keep him there. By the grace of an outside facility that we were on a wait list, that he was accepted. So he's not able to be in our home right now. And currently Medicaid is discussing discharge plans for Charles, and he has nowhere to go other than back home, which involves EMT visits and sheriff's deputies, et cetera, at the house due to his behavior. So my wife and I, as parents, we want to help ourselves. We want to keep our family together, but we need resources to be able to do that. We're fully capable of self-directing care and doing advocating on our son's behalf, but the tools to do that do not exist, and we don't know what to do. Thank you.
Thank you. Thank you for standing up and speaking today. I'm sorry you have been through all that.
Good morning. I want to thank you all for these sessions. They've been very helpful. I've been able to pass information along and maybe some hope. I was at a writers, well, it wasn't a writers conference. I was at Con Carolinas. I was at Dragon Con, and then this past weekend at Conjuration. And the reason I mention that I'm a writer and I write science fiction and fantasy. The reason I mention that is that people would come up to me at these conventions and say, don't you work for an agency that helps people get waivers and whatever? And the answer to that is no. Although it seems like that has become a part of my job. I do a lot of outreach now. In North Carolina, a woman came up to me and said, my sister has a developmental disability. She has autism. Can you help my mother get her waivers? So, I don't know how these people just find me somehow. I have a magnet or something, I don't know. But what I do know is that we appreciate the committee. We appreciate the light you're shining on this community that so desperately needs help. And I've been to every one of these meetings other than one. And I've heard people get up out of the audience and speak and plead for help. So that is my plea today. A part of what I perceive my ongoing job at Smile is education, because people call me and they say, my son just aged out. What do I do now? They have no idea. So they're not getting an education as to what they need to be doing. And you talk about the bucket that has the people in it who are not quite eligible yet age-wise. Those people need help too. They will be needing help. And they need guidance through the system. So we need help there too. But that bucket, while it empties, it also is refilling. But nobody's telling these people how they can get help or that there's even help out there. So I consider education a part of my job going, excuse me, going forward. And I want to thank you again for the hope that you give me and the hope that you give these people, that now that you've shined the light on the problems, that maybe we can go forward and produce good results, increase the number. 513, that's a big number, but when you compare it to 7,155, not really. So I know that Senator Harrell has a 5-year plan to reduce that number to 0. And if I can help with that anytime, you know where to find me. Thank you.
Thanks.
Thank
Nancy.
you. Next up is Taze Kaiser, and on deck is Cindy Levy.
My name is Thais Kaiser. I have a 21-year-old son. His name is Isaiah. Isaiah was failed by the school system. They didn't properly diagnose him, and he was just kind of falling through the gaps. The school system told me that my son, whatever he had, he was going to outgrow it, but it was not true. By the age of 16, he did receive the diagnosis of autism with a very low IQ at 70, adaptability scores at 35. You're not able to get services through the school system. The system said that I wouldn't be able to get any of the services from the Now and Comp Waiver, Katie Beckett, which I fought, got Katie Beckett and anything else except the Now and Comp Waiver. Isaiah is dual diagnosis. On the autism, it's a spectrum. It's not just, you're never going to meet a person that just has autism. You're going to meet someone that has some type of OCD, ADHD, bipolar, schizophrenia. Because my son didn't get the services that he needed at a very young age. Unfortunately, being pushed through the school system, he was diagnosed also with schizophrenia. When I applied for the Now and Comp Waiver, we were denied. They told us that the reason why Isaiah has autism is because his schizophrenia is causing autism, which only made all the doctors laugh. We have applied 3 times. We were denied all 3 times. I'm on my 4th application because I had to hire an attorney, and I'm going to have to spend about $15,000 to appeal that case. And there is no guarantee. There are a lot of parents that are on the list and they're just waiting. I am fighting to get my son on the list. Someone that reads at a 1st grade level, has a 70 IQ, cannot advocate for himself. Despite of all his challenges, he is currently at the Eaton Academy. When I found a proper school for him, he is thriving. He is able to do all the things that I was told by the public school system that he will not be able to do. As when people meet Isaiah, they're like, I'm in love with your son. He doesn't have any behavior issues. He's kind, he's polite, he's very verbal. However, Isaiah mimics those around him. So for someone with a dual diagnosis, now that he's been diagnosed with autism and schizophrenia, if we were to have some kind of issue and I had to put him in the hospital, we wouldn't be able to go into any of the hospital settings because he's dual diagnosis. In order for you to benefit to go into a hospital setting, your IQ has to be at least 85 because you have to be able to retain that information. So I am asking this community to please open up those doors and accept these kids like Isaiah because they can advocate for themselves, and they are here because the system created the issue because they didn't get the early intervention needed. And I thank you for your time. My apologies for blurring everything out.
Thank you.
Thanks, Thais.
On deck is Suzanne.
Good morning. I'm Cindy Levi, CEO of Avita Community Partners and Chair of the Intellectual and Developmental Disability Committee of the Georgia Association of Community Service Boards, or GACSB. The GACSB is a network of community service boards that serve over 3,000 Georgia residents experiencing an intellectual or developmental disability support need. I've followed the committee and I really appreciate all of the efforts that have been put forth. I've been to or watched every one of the meetings and have appreciated the opportunity to present before the committee. One of the things that I'd like to say from the bottom of my heart is the families that we've heard from, the courage that it's taken. My heart goes out to you. And I want you to know that there are providers out there that want to be there to support you in your efforts. One of the challenges is that there has to be funding to be able to support the providers to provide those services. And we want to be able to offer person-centered services. As we've heard from each family, their family member, their loved one has individual needs. It's not cookie cutter. And so I would just encourage that any movement going forward looks at person-centeredness with flexibility. And we do greatly appreciate the 5% rate increase that has been put forth through Appendix K. We all know that that needs to continue. It needs to be permanent. And when we look at it, and we're so grateful to hear that the funds are going to be flowing back from the time that actually they were approved to be issued back in January of last year. And so there are providers that have closed, and it is at really it's at a paramount need right now. And so thank you so much for the opportunity. Thanks for what you're doing. And I look forward to the time whenever Georgia is up on the top of the list instead of the bottom of the list. Thank you.
Thank you. On deck, we have Houston Asher.
Good morning. It's a pleasure to be here with all of you today. My name is Susie Lotharius. I came here today to talk to you mostly about my concerns as a parent. However, I also have extensive experience as a community leader and disability rights advocate, as one of the founders of Every Voice Matters Atlanta, and as a founding board member of Communication First, which is the only national civil rights organization that advocates for individuals with communication-related disabilities. My years spent as a disability rights advocate is a direct result of being the proud mom of my daughter, Graciela. Graciela is 19. She's autistic. As a result of her disability, she has complex communication needs. She requires and deserves a high level of individualized supports to live the life she dreams of living. Her dream includes attending college, being employed, having deep and meaningful friendships, and living within a community where she feels valued and understood. Unfortunately, when I consider Graciela's future in this state, I'm filled with fear. Given the long waiting list for the Now Comp waiver, of which we have applied for twice and have had no word from them, the incompetency of GVRA in supporting autistic individuals with high support needs, the lack of direct support workers, and the low wages they have been being paid, many families, including ours, are left feeling like they have no choice but to develop their own creative solutions to help guarantee a viable future for their disabled child. As you can imagine, this puts even more undue stress on all of us. As the co-founder of Every Voice Matters Atlanta for the past 8 years, I hear my own concerns reverberating amongst the 100 families that we serve. We are all struggling to navigate the best path forward for our children. We all feel that the safety net for individuals with disabilities here in Georgia is thin at best. We hope that we can work together with each one of you here today to do better by those within the state that are often considered the most vulnerable and really are the most vulnerable. Unfortunately, it's true what was said here earlier that families have to break before they can get support. I have my oldest sister passed away unexpectedly in the middle of the night at the age of 59. And one of my biggest fears is that that same kind of thing is going to happen to me and my husband. And that we won't have the things in place that we need to help protect our daughter. So I really appreciate all that you're doing in the committee. I would love to continue to do what I can to work together with you all to make the future better for all of us here in Georgia. So thank you for your time.
Sid, you're up next. This is my constituent.
No, Houston's next. Sid's on deck, right?
Well, but Houston and Katie are together, right?
Okay, yeah, please.
Okay.
Yeah, you're first. Sid,
Yeah.
you're on deck.
Yeah.
This is Houston. He has written his presentation, so I'm going to go ahead and let him speak. He chose this voice, by the way. We are not British, but
my name is Houston Asher. I'm 26 and spent my entire public education in a self-contained classroom where others made every decision of my life only because I could not speak or control my body, even though I was brilliant. No one knew, and they treated me like a toddler and deprived me of everything other students had. No one knew I wanted to be a forensic psychologist or that I could do complex math. No one knew I loved a beautiful girl. People do not understand what autism really is. It is not an intellectual disability. The experts are wrong and have been wrong about me my whole life. Their tests are broken and unreliable, just like our bodies. I do not have the ability to reliably direct my motor, including my speech. I have many other issues that make managing my body very difficult and cause others to judge my intelligence based on my body, which I can't control. I was trapped in my mind, unable to tell anyone what I was thinking or feeling, for 21 years. Only God knows how much I suffered in my silence. That's when I learned about spelling my thoughts. That's when my life changed. Spelling gave me the power back to direct and take control of my life. The reason I want to advocate today is to be a voice for others who don't have motor control. My purpose is to make sure you see others like me as your equals, as intelligent human beings that each have their own opinions about how to live their life and fight to protect their rights. No voice should not equate to no rights, no choice, no education, no meaningful career, no money, no inclusion, no respect, no love or children of my own, and no life. I think it's crazy that so many strangers have so much say over my life and how much help I will receive simply because I can't speak and need help to take care of myself. Those strangers don't know me or care about my life, but they should. I'm letting you see the real truth of how those with disabilities feel. How will I get a chance to make my dreams a reality without good help? My family has given up everything to help me, but all our state does is just keep making it harder to survive. Having a child with disabilities takes away their life too. Moms don't get any choice, or life, or a vacation, or even get to rest for one day. They give their entire life, all their money, energy, time, and future to us. How are they supposed to live longer to take care of us if you never help them? How are they supposed to save money for us to live when they are gone, when they can't afford to live now? The ones who give the most are treated the worst. So what I'm asking is for you to ask yourself, if you were me, what would you need to make your life worth living? How much money would you want to live on if making money wasn't possible? How much help would you want? Getting money won't change our bodies, but it will get us more help. The dreams of those with disabilities matter as much as those with able bodies. I can live the most meaningful life if you let me become the person I'm meant to be.
There's probably not a lot for me to say since he said most everything. But I am a single mom of 5 kids, and he's the second of my children, and I am the sole provider for all of us. There is no help. There is no child support. Houston had to wait 7 years before we received any funding. In the middle, there was a gap where there was no support. Everything was on me, including his care. Even now, I'm not able to pursue a higher level executive position because I have to stay in a position where I have all the flexibility so I can be his care provider, because the now comp, there are not good service providers. The ones that do exist that are good are expensive, so they take more of the resources. And I don't know how, but we just did his reevaluation, and somehow, I guess because he can now communicate, they decided he needed $6,000 less. That's the reality. And so I don't know how we're going to make it. That's just the bottom line. Thank you.
Thank you. On deck, we have Rochelle.
Hi, I'm Sid Besmertnik, better known as the father of Todd Besmertnik. He's well known in the community. He's 35 years old, and he has Down syndrome, and that has not held him back. I wasn't planning on speaking today, but there's some important things that the committee should know. First of all, he has funding now for the last 3 years for group home. He's been in a group home since April 2020, and it has really, really, really helped him change his independence, grow. When we had our holidays recently, he didn't want to come home. He wanted to stay with his roommates. So we compromised and he came home for one night and then spent the holiday with his roommates. Again, independence is so important. But how did we get funding? Number one, he's been in a good program at JFCS, Jewish Family and Career Services in Dunwoody, since he's 23. And he got funding for the first part. I don't remember how, but then the second part was because I had kidney cancer, which I'm okay now, but 4 years ago I had kidney cancer, so they considered it an emergency. 3 years ago, my father-in-law passed away, and my wife had to help her mother, who is now 96. So that was considered an emergency. Emergencies is the only reason we got funding. But moving on to today, things I'm asking you for, we need help in support of employment. He would like a job. Todd would like a job, but whether there is none or whether he can't get one, we need help in that. Number two, DSP salaries. I hear people recommending $15 an hour. Well, I'm also on the board of JFCS, and they increased, they're losing money every year on the program because they're paying $15 an hour and they can't get DSPs. They are short right now, 20 staffer for the group homes and 7 for the day program. So even $15 an hour is not enough. People aren't accepting jobs or aren't staying in those jobs. So please, that's my number one priority, so that his friends can get into these programs also. Thank you for all you do, especially Senator Harrell, for your commitment. And I'm glad to see also Esther Panish and Longtron here today too. Thank you for your time.
Thank you. And our last speaker for the public hearing is Rochelle German.
Rochelle Guyman-Stone, and thank you for adding me on. We were late coming in. Direct care staff was delayed in making it to our home for me to come. What I was going to speak on, I've changed it after listening to everyone's testimony at this hearing. I wanted to thank the committee for being here today and hearing what we had to say. I wanted to talk about intentions and our words and the gap between that. I have a 32-year-old son with severe ID. He's developmentally around 3, doesn't read or write, doesn't talk. He needs help wiping his bottom, brushing his teeth. His beard, I have to shave him. Needs help dressing. He can get his clothes on, but they might be inside out or backwards, or the zippers break, or the buttons, because he's not proficient at those things. He is severely autistic, level 3. And of course, there's a lot that goes along with that. He's going to need lifelong care. We're one of the lucky ones. We got the golden ticket. We have the comp waiver. However, intentions and words. A provider will not accept our son. They look at his HRST, his health risk screening tool, and his behavior plan and say no. We found openings, but the answer is no. No. They don't just tell you no. They make you have the long no. They wait for you to go to interviews, show up at the home, meet the staff, drive the 2 hours away one way and not answer the phone on the door, not letting you know that they received those documents and decided no, and just couldn't face us to tell us no. So my husband and I are in our 60s. My husband's already had a heart attack. We both have health concerns and we both work in healthcare. I work part-time because I don't have enough support hours to work full-time. You know, we haven't had a full night of sleep and I can't remember how long. If we have 4 days where we get 6 hours, we're doing well. And that's just getting up 2 or 3 hours a night, 2 or 3 times a night. Sometimes he goes back to sleep, sometimes he doesn't. Nothing's on our walls. Our house is institutionalized. Every single door has a coded lock on it. Our refrigerator has a lock on it. Our pantry has a lock on it. Try to cook dinner. You know, it's one thing to take people off the waiting list and to award them a waiver. Again, I'm so grateful for it, but we don't have providers that will serve this most in need, this high need of what happens if we pass away, my husband and I. What happens if there's a critical issue? Where does he go? What does he do? I just wanted to bring that to the forefront today, and thank you for being here and allowing me to speak.
Thank you.
Thank you, Rochelle. I think that was a poignant way to close the public hearing because you focused on the multi-pronged solution that we need to go forward and solve this problem. This is our last public meeting, and so I wanted to give all the committee members who want to give any kind of closing statement an opportunity to do that. And I will start. I just want to thank all of you for being such active participants in this process. We've had 5 meetings. We've taken those meetings to North Georgia. We've taken we took a meeting to South Georgia, and every place we have been, we have had a crowd. And in Tifton in particular, we met at Tift Regional Hospital, and we had a lovely room. The hospital was very generous to us, and we had this lovely room all set up for about 30 people. And we had to open an overflow room because we had at least twice that many show up. So I especially want to thank the people who came to these meetings who didn't plan to speak, who found the courage to stand up and tell your story. I know that's not easy. I've had to do that myself in a legislative setting from time to time when it was necessary to put a human touch on an issue that had lost its appeal to that these are real people, these are human people that were bouncing around like basketballs sometimes in our rhetoric. So thank you for that. What happens when you use your voice to speak up is so incredibly powerful because you go from your situation being absolutely invisible to the public to having the visibility that it needs to create pressure on people who have the power to move forward and do something about it. So I just want to thank you for the courage it took to stand up and do that. As the work of the committee, our hardest work, your hardest work is done. Our hardest work is about to begin because we have to take all these voices and all these stories and we have to turn it into action. And it's, this is the first step. As I said at the beginning of the meeting, this is a process that will need to continue. But I just wanted to take a pause and thank you for the role you have played in making change happen in Georgia.
Thank you. I couldn't agree more. Logistically, real quick, we do have a website, Senate Resolution 770.com. Some of you were here today that did not speak, and perhaps that wasn't your thing to public speak. Please go online and submit your comments that way. Those that did speak today that thought, oh, darn, I forgot to add a couple things in there that were important. That's another way that you can do that. I want to ask, though, for your timing to do that really quick, because in order to encompass all that information in the report, Ms. Jocelyn over here is doing a wonderful job helping us, is going to have to gather all that information. As Senator Harrell so eloquently put it, this issue doesn't get solved overnight, nor are we going to come up with a solution, even if it's a couple of years, to not continue to meet. We've already talked about this in great detail. We think this should be an ongoing committee, a standing committee perhaps, that we do this. And we're gonna work together to do better than we're doing today. I can tell you right now, and I always say this about my good friend Heidi and Jacob, they're my greatest inspiration. They're my heroes. And I want everyone to know here that we are hearing everything you are saying. You are loved, you are cared about, and we know we can, and we will do better to help you. So thank you so much for your time. It is again inspiring to all of us, and God bless you. Thank you.
Any other committee members want to make a statement?
Thank you all.
I'm right there with you, Jacob. That was a lot. I've been trying not to lose my composture since Houston spoke, to be honest. Thank you all. Thank you both. I think we're all encouraged. The work is big, but we're committed and we're in it for the long haul.
Anyone else?
I'm not a public speaker. I'm a policy writer. So bear with me, but I've been holding back tears this entire committee, and these stories inform what we do on such a significant level that I feel just the utmost appreciation. I didn't prepare a closing speech, so bear with me. But I just feel the utmost appreciation for this committee and being a part of this committee, because it'll inform so many conversations moving forward. And I believe we have the tools that we need in order to make really significant changes. And I'm committed to do that. And I'm here to do that. So on behalf of the committee, I thank everyone today and the other hearings for your testimonies. They mean so much to us. Thank you so much.
Okay, this concludes our 5th meeting. Go forth and happy Thanksgiving.
Yes. Great meeting.